Hello viewers, you're welcome back to the Guided Midwife channel. Please, if this is the first time you're coming across my video, this is the Guided Midwife channel and we talk about everything preconception, pregnancy, labor and postpartum. So please, if you are really interested in my videos, please kindly subscribe to my channel for more educative videos. If you also have any question, you can also leave it at the comment section and I will reply you with the answer. So please, on today's episode on the Guided Midwife channel, I'm going to talk about the physiological changes that occurs during pregnancy. So these changes affect all the systems. When I say systems, I'm talking about the reproductive system, the cardiovascular system, the integumentary system, the urinary system. Let's move on to the integumentary system. So when you say integumentary system, it's all about the skin. So pregnancy also affects the skin. So during pregnancy, there is increased deposition of melanin at some parts of the body. When we say melanin, it's a dark pigmentation. That's why we call dark people melanin. It's a dark or a black pigmentation. So during pregnancy, there is increased deposition of melanin or that dark pigmentation at some parts of the body. So during pregnancy, you could see that the neck of a pregnant woman becomes more darkened, the armpit, the vulva, and the face as well. So with the face pigmentation, it's called the chloasma, or the marks of pregnancy. So when a woman is pregnant, you can see this darkened part or darkened portion at some parts of the face. It's due to melanin deposition. So there is a white line between the rectus muscles. So when you are not pregnant, the line is white. But when you become pregnant or when you are pregnant, there is increased deposition of melanin at that part. So the white line becomes dark. That's why when you look at the abdomen of a pregnant woman, you could see a line extending from the navel to the symphysis pubis or the upper parts of the vulva. So that black line, it's called linea nigra. In pregnancy, it's called linea nigra. And pregnant women tend to have stretch marks on their abdomen. And these stretch marks are at times darkened. It's due to the melanin deposition. So these stretch marks during pregnancy, or the stretch marks that comes as a result of pregnancy, it's called the striae gravidarum. It's called striae gravidarum. But if you are not pregnant and you are having stretch marks, it's called striae. So another name for stretch marks, if you're having stretch marks but you're not pregnant, it's called the striae. But if you are pregnant and you're having stretch marks, and the stretch marks is as a result of the pregnancy, it's called striae gravidarum. Let's move on to the cardiovascular system. So when you say cardiovascular system, it means we're talking about the heart. So during pregnancy, there is an increase in blood volume, leading to an increase in cardiac output. So due to the developing baby in the uterus, the cardiac output of the woman increases, like the heart beats faster in order to be pumping blood to these vital organs in the woman. So let's talk about the urinary system. So when you say the urinary system, you're talking about the ureter, uretress, the bladder, and so on. So during pregnancy, there's something called the frequency of maturation. The meaning of frequency of maturation is that during pregnancy, pregnant women tend to urinate more frequently. Like they can urinate like 10 to 12 times a day. And this urine is very, very small. And do you know the reason why this frequency of maturation occurs during pregnancy? Of which, when they go and urinate, the urine is very tiny, like it's very minimal, it's very small. But they always have the urge to urinate. It's like they feel their bladder is full, so they will have that kind of urge to void it out. So anatomically, the bladder is very closer to the uterus. So they share walls, they are in a position, they are very close to each other. So after pregnancy has taken place, or after fertilization, as the baby is developing in the uterus, if the bladder is able to contain like 500 mils of urine, because the baby is developing and the bladder is very closer to the uterus, the uterus puts pressure on the bladder, so the bladder can only contain like 20 mils or like 50 mils of urine. So it's like after the bladder has been able to contain that urine, there's a signal that it sends signal to the brain that like the bladder is full, so the woman has to go and void out the urine. Because the uterus is putting pressure on the bladder, the space in the bladder has been decreased. So that's the reason why pregnant women tend to void out urine during pregnancy. And this frequency of maturation occurs during the first and third trimester. When I say first trimester, is from fertilization to the 12th week of pregnancy. Second trimester is from the 12th week to the 24th week during pregnancy, and the third trimester from the 24th week till the woman delivers. So when I'm calculating, or when I'm saying it in months, the first trimester is from 0 to 3 months. Second trimester is from 3 months to 6 months, and then third trimester is from 6 months to the 9th month. So the frequency of maturation occurs more in the first trimester and the third trimester, because the uterus is in the pelvic cavity, or is closer to the bladder. So as I explained earlier, as the baby develops, it puts pressure on the bladder, and the space in the bladder decreases, so the amount of urine the bladder will be able to contain also decreases. So with the smallest amount of urine that fills the bladder, the woman will always have the urge to void out urine. So as pregnancy advances, the uterus moves from the pelvic cavity into the abdominal cavity. The pressure being exerted from the uterus onto the bladder ceases, because now the uterus is now in the abdominal cavity. So now the bladder comes back to normal, of which it can contain any amount of urine. Now during the third trimester, as the baby descends back into the pelvic cavity for it to be born, it then exerts pressure on the bladder again. So the frequency of maturation occurs more in the first and third trimester. They educate women that they should always keep their vulva clean and dry. So after you urinate, you have to keep the place dry, because if you don't do so, it can create a medium for bacterial growth, and it can lead to UTI, that's urinary tract infection. And this urinary tract infection is quite dangerous because it can cause contractions, of which your time might not be due and you are going to have a premature baby. So talking about the respiratory system, pregnant women tend to have difficulty in breathing, or tend to have faster breathing during pregnancy. And this is the reason. During pregnancy, when the gravid uterus or the uterus comes into the abdominal cavity, it pushes on the lobes of the lungs, or it puts pressure on the diaphragm, making breathing very difficult for pregnant women. So they tend to breathe faster to meet oxygen requirements. So they tend to have higher respiratory rate. So during the third trimester, where the uterus descends down into the pelvic cavity for the baby or the fetus to be born, the pressure from the diaphragm and the lobes of the lungs are being relieved. So they tend to have normal respiratory rate, and they tend to breathe normal. So they tend to be okay during the third trimester, because there is no pressure being exerting on the lungs and diaphragm. Lastly, we're talking about the skeletal system. So progesterone and estrogen always play a role during pregnancy. So progesterone relaxes, or it softens the ligament at the joint, making this joint very lax, especially with the pelvic joint. So when these ligaments are being laxed, it causes some kind of discomfort and back pain. So the moment these pregnant women, they walk for some few seconds, they get tired, because these ligaments at the pelvic region and other joints are being laxed and softened. And they also tend to have this posture, like the lordosis posture, like they tend to have their chest moved forward, like with that big tummy. It's called the pride of pregnancy, because that posture causes this back pain? Due to the heaviness of the gravid uterus or the fetus in the uterus. So lovely viewers, this comes to an end to the physiological changes that occurs during pregnancy. So please, if you've not subscribed to my YouTube channel, that's the Guided Midwife channel, please kindly do so for me and stay tuned for more educative videos. Thank you.